After 169 hospitals, a dad finally got the COVID-19 care he needed and changed dozens of skeptics' minds. Just a few weeks ago, the Florida father of 6 was on a ventilator with COVID-19 pneumonia in both lungs. Like most Americans hospitalized with COVID-19, Walker was not vaccinated, but all the beds are taken up by COVID victims also getting ECMO treatment, Susan Walker said at that time. So now we're desperately searching outside of the state just for a hospital to take him. What happened next stunned the Walkers, saved Robbie's life, and may have spared countless other families from suffering. The virus spread like wildfire. No one knows exactly when or where Robbie Walker got infected. But no one in the family was vaccinated. Susan had tested positive for COVID-19 in December and assumed her antibodies would protect her, and the family had a false sense of security because more businesses were fully reopening. Our state had opened up. Less people were wearing masks, thinking things were going back to normal, Susan said.
We let our guard down, and then we were blindsided. Within a few days, Robbie developed a fever and tested positive for COVID-19. Shortly afterward, 11 other family members and friends went on a boat trip. All 11 of them became infected, Susan said. It spread like wildfire, she said. Susan did not get sick this summer. But she says her son, her brother-in-law, her cousin, and her cousin's fiancé all got COVID-19. But it was her 52-year-old husband who suffered the most. The fever had progressed to pneumonia in both lungs, and he was rushed to an emergency room. On July 25th, Robbie called his wife from his hospital bed and told her he had made a gut-wrenching decision. He had signed the papers to be intubated, Susan said. Some COVID-19 patients who get put on ventilators don't survive the disease. Their final calls to their families before intubation are their last. He cried and just told me how regretful he was of not getting the shot, Susan said. And he begged me to go get vaccinated. She did. She also started a cross-country mission to save her husband's life. Striking out after 169 hospitals in several states 10 days after Robbie was intubated, a doctor told Susan her husband most likely was not going to make it out of the hospital. When they told me he was dying, I just didn't accept it, she said. Susan asked about the possibility of a lung transplant, but learned the waiting list for lungs is extensive due to the surge of COVID-19 patients, she recalled. Another option was ECMO, extracorporeal membrane oxygenation. But with Florida's recent influx of hospitalized COVID-19 patients, ECMO availability for Robbie was scarce to non-existent. We have searched every hospital from the south of Florida to the north part of Florida, Susan said in early August. So family members created a list of hospitals to call and see if anyone had ECMO availability. Susan started the search by Googling ECMO hospitals in Florida, then Georgia, Louisiana, Alabama, Virginia. The family called 169 hospitals. No one was able to take Robbie. A risky 1,200-mile journey. I just clicked on it and watched it, and it was pretty compelling, said Gallagher, chief of cardiothoracic surgery at Trinity Health of New England. He forwarded Susan's interview to the chief perfusionist, who runs the ECMO machines, and decided to try to get Robbie Walker to Connecticut. But the journey from Florida to Connecticut was arduous. Robbie was intubated and placed on a specially equipped medical flight. Susan was not allowed to fly with him, so she drove 22 hours to Connecticut, hoping her husband would still be alive when she got there. It was kind of my Hail Mary, because if I would have not taken the chance, they just would have had no choice but to leave him there and have his organs fail one by one, Susan said. Robbie survived the 1,200-mile journey and started ECMO treatment at St. Francis Hospital in Hartford. Gallagher was there to help treat him, and then gets rainfused through the ECMO machine through, usually, the jugular vein, back into the area around the heart. It was a shocking sight for Susan. Robbie spent 22 days on ECMO, and Susan spent as much time with him as she could. She got to know the family of a nearby COVID-19 patient who was younger than Robbie. That patient soon died. I sit in the hospital room and I just listen to, the door next to Robbie, she said. The family comes in, screaming and crying. I cry. It's just devastating. Then on September 2nd, Robbie Walker was taken off ECMO treatment. His heart and lungs were able to support him again. If not for Gallagher, I'd probably be sitting in front of a tombstone, Susan said. ECMO treatment does not guarantee survival, Gallagher said. At his hospital, about 50% to 60% of COVID-19 patients who go on ECMO survive. But without ECMO, he said, Robbie Walker probably would not have survived. From vaccine hesitant to vaccine insistent, Robbie Walker lost 50 pounds while he was hospitalized with COVID-19. After weeks of muscle erosion, the formerly sturdy construction business owner who exercised at the gym daily now struggles to stand up. We just started physical therapy this week, Robbie said Thursday. I can already tell a difference from last week. He got emotional when he talked about how hard Susan and other family members worked to find life-saving treatment for him. I couldn't be more proud of her, Robbie said, crying. She's my hero. He also credited Gallagher and the chief perfusionist for making his recovery possible. And now that he can talk again, Robbie has made one request abundantly clear. Susan said, my husband has decided when we get home, if you're not vaccinated, you're not going to come around him. Robbie said he's concerned about the possibility of getting infected again. We've talked about putting a sign on the front door, if you're not vaccinated, you can't come in. We'll talk on the yard, Robbie said. The family's ordeal has inspired at least 60 friends, family, and colleagues to get the COVID-19 vaccine, Susan said. April Torrey and her husband were not anti-vaxxers, she said. But they were concerned after a family friend's relative started trembling a week after her vaccination in March. Torrey said that family believes it was the result of the vaccination, though the cause is not certain. My husband and I said, no, we're not. We don't know about it. It's not going to happen, said Torrey, a friend of Robbie's and an employee at Susan's real estate title business. We were no, and then Robbie happened. It made us think twice. And since Robbie was hospitalized, 2 lifelong friends from their hometown of Claremont, Florida, died from COVID-19, Torrey said. Both were under age 50. Neither was vaccinated.
Thank you for watching. Please subscribe.